The outcome of falls in neurological diseases. Stroke. Stroke patients face a significantly higher risk of fractures compared to age and sex-matched individuals without stroke. Studies indicate that between 14% and 65% of stroke survivors experience at least one fall during hospitalization, while 37% to 73% fall within the first 6 months after discharge. Even in later stages of recovery, their fall risk remains elevated relative to peers of similar age. Transitional periods, such as transfers from acute care to rehabilitation or from rehabilitation to home, are particularly high risk, especially during the first week of rehabilitation and the initial 2 months post-discharge. The etiology of falls in stroke patients is multifactorial, though gait impairment is a predominant contributor. Acute health issues, e.g., pneumonia, urinary tract infections, and prior falls further elevate the likelihood of future falls. Additionally, prolonged inactivity can lead to physical deconditioning, exacerbating fall risk. Falls in stroke survivors often result in fractures, which significantly worsen clinical outcomes. One longitudinal study followed 1,139 acute stroke patients, 630 males, for a median of 2.9 years, documenting 154 fractures in 120 participants, an incidence rate of 37 fractures per 1,000 person-years. Falls accounted for 84% of these fractures, with hip fractures being the most common. Notably, stroke patients were 2 to 4 times more likely to sustain a hip fracture than age-matched controls. Subsequent research found that stroke survivors with hip fractures had poorer survival rates and lower chances of regaining independent mobility compared to non-stroke hip fracture patients. More recent data indicate that post-stroke individuals face a 7-fold increase in fracture risk, particularly at the hip, with the highest risk occurring in younger patients and within the first year after stroke. Hip fractures in stroke patients are driven by both osteoporosis and frequent falls. Stroke-related factors such as muscle weakness, balance deficits, visual impairments, and epilepsy further predispose individuals to falls. One study reported that 73% of stroke patients with mild to moderate disability fell within 6 months of discharge, with falls predominantly occurring on the paretic side.